Good morning. Thank you so much for having me. They say, my name is Krista Benes, and I work with the Mental Health Commission of Canada. I'm a program manager at the Commission with the Workplace Mental Health team. And a couple of things I'm hearing from my colleagues this morning is around being informed and being able to create partnerships and the importance of community. And I'm so fortunate in my role at the Commission to be working with various stakeholders across the country who are, really experts in the field. So being called an expert myself, I feel like I'm stealing the title from others, because really the work that we do could not be done without being informed by the work that's happening with researchers, with community partners, community service organizations, and those individuals who work closely with policy around income support. So I draw from those conversations, from those research papers and everything today in my talk. So we've heard this morning a lot about, and I'm sure yesterday as well, unfortunately I couldn't be here. We were hosting an event around mental health and employment yesterday in the city, so unfortunately I was unable to attend. But we heard a lot about the value of employment and what that means to individuals, to all of us really. It not only provides a paycheck, but a sense of purpose, opportunities to learn, and a sense of community. Most importantly, it offers hope to individuals who suffer from mental illness as a way to work towards recovery. Yet, mental illness exacts a high price on individuals, employers, and the economy. We know that mental illnesses are the leading cause of disability in Canada, and that individuals with mental illness are much less likely to be employed, with those who have the most serious forms of mental illness being 70 to 90% most likely to be unemployed. In Canada, approximately $28.8 billion are spent each year in disability income support. And of that, almost 1/3 of disability spending from income support programs across Canada are for mental health related reasons. This is a cost to Canadian taxpayers of approximately $9.6 billion per year. Yet, research shows that individuals living with a disability, including those with a mental illness, are as, if not more qualified, reliable, safe, loyal, high-performing than their colleagues without a disability. The Mental Health Commission of Canada published the Aspiring Workforce Report in 2013. And in this report, it coined the term aspiring workers. So that's the file that I'm closely affiliated with at the Commission. And aspiring workers refers to a group of people who are either struggling to get back to work due to mental illness, are in work and struggling to maintain their employment there, or want to return to work after a lengthy period of being away. And the intent of this report was to identify existing and innovative practices that were supporting people with mental illness to get attached to employment, and to find and secure sustainable and meaningful employment for themselves. Some of the key recommendations that came out of this report included, this paradigm shift of destigmatizing people with a mental health issue in the workplace. It looked at the collaboration across different sectors, including different various levels of governments, ministries, and all the actors, and looking at the importance of creating partnership and collaboration across these sectors. The report looked at removing disincentives to work. And we've heard about how our current income support systems create barriers with few incentives to return to work. We've heard that those receiving disability income supports fear exiting these programs, and that they're not going to be able to quickly return to them if needed. As we know, mental health issues are episodic, so when somebody's feeling really well and they get a job and they start working, and suddenly things can go wrong fairly quickly and they can become sick and need to take that time away. But without having access to a stable, secure income to support their housing, to support their family, these things are very important. The report looked at existing best practices while continuing to innovate, looked at supportive employment programs, the ideal of social businesses and social enterprises, and how these tools can be used to support people with mental illness to find employment. It looked at early intervention and how important it is to support people to return to work and to get connected with their supports soon after they first discover that they're suffering from a mental health problem. The report made recommendations around system capacity building. Compared to other OECD countries, Canada ranks 27th of 29 countries surveyed on public spending for disability-related supports. We also, the report also looked to encourage knowledgeable consumers. So success requires both employees and employers to be on board and aware of their rights and supports that are available to them. So some of the initiatives that we're working on right now in the Commission and over the next 2 years is we're promoting employment for people living with a mental illness. We're sharing best practices for employers, job seekers, community agencies that make the business case for hiring and retaining people living with mental health problems and mental illnesses. We're trying to inform policy at all levels of government. So specifically, the projects that I'm working on is yesterday, as I say, we were fortunate enough to gather members of government from all levels, community stakeholders, researchers, some of whom are in the room today, to discuss and really identify actionable items for government in relation to disability and income supports. And come away from the day sort of gathering input from all of these stakeholders and really come together with some actionable items to recommend changes to support employment for individuals with mental health issues. We did develop a discussion paper, which I would be happy to share with anyone who's interested in advance of that event. So please come see me and pass along your business card. And we will be developing a final report from the day, consolidating the feedback that we heard from everyone, and really just trying to, as I say, identify some next steps for moving forward. We're working with employers and employment agencies. So we're partnering with an organization called Magnet. I don't know if anyone's familiar with Magnet, but they're an online job finding tool that we've partnered with to develop some targeted resources around mental health in the workplace. And we're running a small pilot with employers and job seekers with lived experience to try and target resources at a just-in-time point around accommodations in the workplace, how to have a conversation with your employer if you choose to self-disclose. And the same mirrored resources will be provided to both audiences. So the employers will be learning about how to have a conversation with their employee, how to recognize and make positive changes in their workplace to make it more psychologically healthy and safe. And on the contrary, the job seeker is going to be receiving the same information. And we're hoping that through this online platform, which is really, Magnet has been developed to support unemployment and underemployment in Canada. And so it's really working closely with a number of disability support groups across the country to try and raise those levels of employment. And we're hoping that this will be one avenue that will do that. We've also funded some research around creating the business case for employers to actively hire, recruit, and accommodate people living with mental illness. We have some of the great researchers that worked on this report in this room today, and we're very excited to be working towards creating a shorter condensed final report from the research report right now to be released publicly, and I'm happy again to share that information. If anyone wants a copy of the technical report, we can pass that along as well. But the results are incredible. Really, they're showing that to make accommodations in the workplace, the research looked at 5 organizations, employers of various sizes across various different sectors, and looked at the ways that individuals are being accommodated in the workplace right now, and actually developed a calculation for how do you put those accommodations, how do you calculate the return on investment of those accommodations. And the return on investment is significant. With some individuals, the return on those accommodating those individuals being 7 times greater than the investment. I'm happy to point you to those researchers in the room after this talk as well, so that they can give you a bit more information on that report. The Commission has invested in the Social Enterprise Ecosystem Project, which connects training, marketing, and impact measurement resources for social enterprises anywhere in Canada. So social business is a commercial venture just like any other business, but what it does is it really looks to support, and it also looks to achieve economic benefits the same as any other business would. But what it does is that we're looking at those social businesses who employ individuals with mental illness and how they can support individuals to enter into the workplace to get the experience that they need while offering them the opportunity to learn, opportunities for collegiality, and obviously access to an income. So we're partnering with the Social Enterprise Institute to help deliver webinars and online learning and coaching and support to those social enterprises who hire people with mental illness. Around job seekers and HR professionals, MHCC is leading an environmental scan, which is looking at supported employment programs across the country to see where they're located and what model they're using, whether that's a model that's affiliated with the IPS model, the individual placement support model of supported employment, or if it's a hybrid of those types of employments. And what we're going to create from that, hopefully, is a very interactive map that can be used to see, if you're in Alberta, where are the supported employment agencies around you, and what are they doing to help people with mental health issues find employment? We're going to be hosting a national forum on supported employment next summer in Halifax. We're going to be working with a number of stakeholders across the country to hopefully develop a community of practice so that there's shared evidence-based practices for people working in supported employment areas, that they can be able to use this resource and benefit from access to those supports. I think that's everything. Thank you.